We're with Dr. Dowell, who is Natrona County's health officer, just trying to get a little update on COVID. So the hospital's still pretty much filled with patients.
It is packed, and it has more patients now with COVID than we had a year ago during that surge. And this surge is very aggressive in terms of how ill people are. Pound for pound, people are more ill with this surge than they were a year ago.
And continuing to be younger patients that are now going to the ER unit.
No question, the demographics have changed. We've seen people in the hospital in their 20s, a lot of people in their 30s and 40s, very, very sick, a lot of people on ventilators. It is really tough right now, and basically none of them are vaccinated.
So if people want to get a booster, and you're suggesting they get a booster, Pfizer has been out, and the health department has been giving out the Pfizer booster. But what about people that got Moderna or Johnson & Johnson?
Well, first of all, anybody that hasn't had the vaccine yet, look at your community. We're as active as any place in the United States in terms of cases right now, and we have basically the lowest vaccination rate in the United States as a state. The number of cases in Wyoming are not going down. The number of hospitalizations are not going down. Here's a tool to use. More of us need to use it. For those people that have been vaccinated, we really need to do something about that. They need a booster. If you had Pfizer, get another Pfizer booster. If you fit into the categories, immune problems, high risk occupation, 65 and older. If you got Moderna, hang in there. It may be as early as next week, they will approve Moderna booster. The Moderna booster will be a half dose. That's fine. That's all you need. For those people that got Johnson & Johnson, hopefully next week they'll approve a booster for Johnson & Johnson. You will have options. You can get another Johnson & Johnson, and with Johnson & Johnson, anybody over age 18, doesn't matter if you have health issues or not, can get a booster. So that's different than Pfizer and Moderna. If I got a Johnson & Johnson, I would boost it with Moderna or Pfizer. Get the virus a different look. You can always boost it with another Johnson & Johnson, but I actually think it's better to go the other direction. And yes, you'll be able to mix and match the vaccine. So if you got Moderna and you want to get a booster and you don't have quick access to Moderna, you can get a Pfizer. If you've had Pfizer, you could get a Moderna. That's what they're going to approve within the next few days. One last thing, the vaccine for kids age 5 and 11 will be here shortly, maybe by early to mid-November. Obviously, it would help our school system cut down the risk of long-term illness in kids if parents will allow these kids to get it. It's highly effective in the studies, and kids are tolerating it beautifully.
All right, Dr. Dow, we appreciate you talking with us, and we'll stay in touch.
I'll stay busy.
All right.